Treating a fetus is a unique privilege. We go places that people were not supposed to go. This sacred, sanctified environment inside the womb that you're being formed in the dark and hidden away from the human eye. But now, not only can we see what's going by ultrasound, but we can actually get in and look with little instruments and scopes and cameras. We can actually open the uterus and touch the fetus and operate on the fetus. I, for one, consider it a blessing and a privilege to actually be able to do that. These women and their families trust us with the care of their most precious. And we approach that with a lot of awe and also with a lot of caution, treating it with the utmost respect and dignity that they deserve. So my prayer every day is to be an answer to someone's prayers.
Hi, it's Carmen with the Fetal Center at Texas Children's. When I meet a family for the first time, it's usually on the phone. They come from an emotional high of they're pregnant and they're happy and they got through their first trimester and everything is great. And now they get their level 2 ultrasound with their OB and something's not right, and now they're picking up the phone to the Fetal Center. And so they're really in a state of crisis and they need someone who's going to be their stability. And so that's sort of what we figure we are.
1477.
We'll help them arrange for housing, we'll help them find out if they can stay at the Ronald McDonald House. And then the social work services within this facility are really outstanding. We have child life specialists here who help families help their children understand what's going on. So we have all sorts of resources. And the piece that I offer is to make sure that they get to see those people and that they know those resources are out there.
Our coordinators are the heart of our team. They are the glue that holds everybody together. And they are really the person on whom the patient leans the most. They're compassionate, but not only that, they're able to make the necessary connections with a very large group, a multidisciplinary group, and ease the burden of the diagnosis for the patients.
We give them the person to call at any time. We're there from the beginning to the very end of their delivery. You have to make sure that you offer them hope and that you can support them and be behind them and that they know they have the people they need.
You look wonderful. You look much better today. You feel better?
Freshly bathed, yes, sir.
Good. Nice to see you again.
Nice to see you.
By the time a lot of patients come to us, they're so well informed and at times misinformed. And so one of the things I actually do when I meet with families is I want to know how much you know. I want to know everything you've read off the internet. Knowing what they've been exposed to, we can help guide their thoughts. Because it's not just a matter of providing correct information, but also to provide hope for what could be.
How are you?
Good, how are you?
How have you been doing since we last saw you?
Doing pretty good.
Any problems?
No, not at all.
Baby's growing?
Yes, moving a lot.
All right. When a couple comes to us, it's our job to make this welcoming to families and to really make them feel like we're going to take care of them and we're going to take care of that child. We want to make sure that we are as accurate as we possibly can be with what your child has and what we need to do and what the outlook is. So that you can see.
It's good. It's perfect.
We'll set up the appointments so they can have as many of their appointments on the same day as possible. Our goal is to make it one visit to see the people they need so they come away with an idea of what's wrong with the baby, what we can do, and what we need to do next. And that offers a lot of comfort to families to be able to know what's next.
They do come to radiology first. Ultrasound and MRI are very complementary. We use the two together to come down with a diagnosis. The imaging group here, you're dealing with people that are very specialized in their training. All of the fetal imagers have done full residency training in just radiology, but have then gone beyond that and done specialty training in pediatric radiology. So you're dealing with people that our sole purpose is to treat and diagnose babies.
The last thing a mother wants is to be told, you know, we've identified a problem. It's going to be 5 days before we can get you an appointment in another building. At the Texas Children's Fetal Center, patients come to the pavilion for women, and that's where they stay. The experts and the specialists, all of the people who are going to be involved in the care of their baby, come to the patient.
The family is going to make the decision on how their baby is cared for. They're going to make all the decisions about it, and to empower them to make those decisions is the right thing to do.
So this was a case we presented last week, and there was of course, a lot of discussion because this is about the Multi-Disciplinary Conference is a weekly meeting that we have, and it's actually one of the highlights of my week.
The culture here is to do whatever it takes to get the best outcome. And that's a team endeavor.
We have expertise from different spheres of medicine: obstetrics, genetics, maternal fetal medicine, surgery, pediatrics, cardiology, name it, all in the room talking about different aspects of the care of each fetus. Not many places have that full complement of expertise, not only of maternal care, not only of fetal care, but even of the pediatric component thereafter.
Because we have such a range of expertise, we're able to handle rare cases. We do fetal cardiac interventions, resections of tumors, and we're developing new procedures for spina bifida and congenital diaphragmatic hernia. We're seeing a significant increase in referrals as people get to find out what we're able to do here. And the increasing volumes, I think, are very important because each of these components of our team has to function together in a very fluid way. And the only way you get to that is by doing it over and over again.
Any child with congenital heart disease needs to be taken care of at a center that does many open heart surgeries because the outcomes are going to be better. Each step along the way, you get handled with specialists that are accustomed to dealing with these problems on a very regular, routine basis. That gives your child outstanding care from the minute we touch your abdomen with the transducer and make that diagnosis to the minute you leave the hospital with a child who's had heart surgery.
This is Aiden. He's 4 weeks old now. He was born at 6 pounds, 6 ounces, but now he's up to over 7 pounds, so we're pretty excited about that.
Jennifer came to us early on in her pregnancy. She had been diagnosed with a baby with hypoplastic left heart syndrome. We met them, we talked with them, and presented to them that we would do fetal cardiac intervention.
It's completely different than what you would expect it to be, especially with your first. It just makes it kind of difficult, I guess. You know, it's a blessing, but at the same time, it's scary. I mean, you know, because you just don't know. And you try to be strong because you just don't expect it, but then you have somebody like this to look at every day, and, you know, and he stays strong, and he's been very strong the whole time. He's definitely a fighter, so you couldn't ask for more of a blessing than that.
When Aiden was delivered, we had a cardiac cath team on standby. We had a heart surgery team on standby. He required none of it. It was beautiful. What we all want as parents is for our children to have a good, happy life. And if you can do something to start them off the right way, you can impact their outcomes for a lifetime. When I get to go to one of the deliveries and the family's happy and the baby looks great, it's a really great moment.
It feels like an incredible privilege to be trusted by a patient and her family to do this. I'm very proud of what we've accomplished. I'm very proud of the people that I work with. But at the end of the day, I realize that this is a massive privilege that is granted to us by our patients.
It's a passion. Making a diagnosis in utero and then having these kids go off to college or, you know, getting to go to their weddings. That's what's neat.
That's why we give up our lunchtime, and that's why we stay late, and that's why we squeeze things in when there's no room on the schedule. Because we know that for that family, just taking out of our time to do that extra step means more to that family than it'll cost us. And putting our heart into it, I think is what really drives us.
I ache for families that say, we're not gonna have a baby shower, we're not gonna tell any of our friends. I don't want that. I want to be the center of their hope. I want them to know that I'm going to offer them hope and I will be there for them. It's not perfect. Life's not perfect, but it's good. It's good.